We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, there are now fewer than 100 coronavirus inpatients in the Huntsville hospital system. Obviously, we would all like that number to be zero, but are you in any way encouraged by where that number is at right now?
Absolutely. So it's definitely encouraging to see less cases. I can tell you we still continue every day. There is admission through the emergency room for COVID-19 patients, but it stayed for the last few weeks now where it stays around that number. Might be a little bit less or up. We want it less and less, but it definitely, as a healthcare professional, it definitely encouraging as less pressure on the hospital and the healthcare system, but also our patients. You know, we don't see significant severe illnesses as well, or pressure on these patients. So we're happy for our patients as well.
Yeah, that is encouraging. So local leaders, including Huntsville Hospital CEO David Spillers, says he's concerned about a potential spike after Labor Day weekend. From what you have seen with masking and social distancing, how concerned are you about another spike?
You know, we've seen definitely the masking and physical distancing good, but I still think there are areas where you go in Huntsville or Madison County where people is not following the rules. The concern, of course, you know, it's usually about 2 weeks from Labor Day, so we are still, by next week, we'll see how things are going to go. Till now, we're not seeing that spike, and I'm hopeful we'll bypass this and we won't have significant issues.
Dr. Hassoun, one thing that everyone wants to know is when will we have a coronavirus vaccine? We're hearing that a vaccine could be ready within the next few months, but even if that happens, making sure everyone gets it is another challenge. When do you think it will be available to those who really want it?
So I think the vaccine as such, probably by the end of the year, we'll get vaccine available. But probably for everyone to get it is probably sometime February, March of next year, unless there's going to be more acceleration of production. But the main thing I'm still concerned about, we really still don't have much data about phase 3. So the longer this is going to take, and it's probably that's the usual thing for it, meaning October or November, it's going to push the time where the release of the vaccine is going to happen.
Just like the flu shot, though, a lot of people say they won't get that vaccine, even if it is available. So what would you say to them, and how dangerous is that for others?
Yeah, I think people are going to need to understand, when we talk about vaccination, vaccination is not only necessarily for the person who receives it. Vaccination is about the community, the whole community. Because when I get the vaccine, yes, I will have less chance of getting the infection, possibly by 50%, reduce the chances of severe illness by about 75%. This is a general term we're talking about with vaccination. By doing this, if I don't get the infection, then I wouldn't be able to transmit anything to another person. At the same time, if it's mild, then it will be less likely getting transmitted. And by doing all this, the community will have much less infection rate. And by doing this, we'll have, you know, much better outcome in every aspect.
Dr. Hassoun, with where we are right now, what is your biggest concern moving forward when it comes to dealing with the coronavirus pandemic?
So two really main things. One is we really still don't have effective treatment yet. And that's what's concerning, because if we get significant spike during the winter, we don't have the vaccination yet, we're going to go through what happened in July, or similar to what happened in other areas like New York, for example, with significant increase in mortality and stuff. And that's very, very concerning. The other part is still concerning to me. There are people still not following the basic prevention principles, because that's what's essential at the moment to use, and that's the best what we have at the moment.
All right, we'll leave it there. Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital.
As always, thank you so much, Dr. Hassoun, for your time and your insight.
Thank you so much.